Hi, uh, I was thinking about doing something related to the medicine today, simply because there are a couple of new things which have happened over the last 2 or 3 months, and I thought I would bring it to the attention of people that are interested. Many times I see patients, and when the CAT scans are done, people talk about some scar tissues. A lot of people have asked the question about how did these scars develop and what can you do about it. So I want to kind of clarify a couple of things here, that anytime, whenever there is an injury, it heals with the scar tissue. And the best example that I can give you would be the skin. And of course, some scars are deep and remain or leave a permanent mark. And then there are others which are superficial, and after months, years, you may not recognize that there was an injury in that particular area of the skin. But the lungs scars are a little different. Lung has significant air supply or oxygen supply from various places. And the healing power of the lung is really great. And so many times even bad pneumonias or bronchitis may not leave you with much scars. But sometimes when we see certain densities, we call it as scars, but that's not of a concern or does not affect the function of the lung. So I want to specify that there are some scars which are seen which are related to previous infections or pneumonias and may not have any functional damage to the lung capacity. The scars that I'm talking about, it is called fibrosis. And the fibrosis can occur in many patients either related to known causes or it can occur related to unknown causes. Whenever it is related to unknown causes, it is called idiopathic pulmonary fibrosis, scar tissues in the lung related to unknown cause. Now again, this must be separated from what I just mentioned earlier. So this particular scar tissue, which in certain patients is rapidly progressing or harmful, is called IPF, idiopathic pulmonary fibrosis, leads invariably to shortness of breath, cough, lack of oxygen, and death. Again, fortunately, this is not the common progression of most of the scars. But as I was mentioning it to you, there are secondary causes of scars. The best one that I can tell you would be a very bad pneumonia. But then there are other conditions like rheumatoid arthritis, scleroderma, lupus, sarcoidosis. These are conditions where one is left with damaged bronchial tubes and scar tissues, and that can lead to also similar problems like cough, shortness of breath, lack of oxygen, and a progressive condition can lead to impairment and disability and death. So the news that I was telling you is about there was a couple of drugs which were approved about 5 or 6 years ago for scars in the lung of unknown origin when they are progressive. Please remember, we're talking about idiopathic pulmonary fibrosis, which is progressive condition in many patients but not in all. And that is where these drugs were approved. So the two drugs that were approved were called OFEV, OFEV, and the other one is called Esbriet, ESBARIGHT. So these two drugs were approved about 5 or 6 years ago for fibrosis of unknown etiology, which is in a progressive disease. But recently, they were also approved for other condition, or rather the OFEV was approved for the other condition. So please note that up till now, if somebody had rheumatoid arthritis or scleroderma and had worsening scar tissue, we could use other drugs, including steroids, including some of the immunosuppressants, but we could not use these newly released drugs which have relatively low side effect profile. But now, OFEV is approved for the scar tissues in the lung caused by rheumatoid arthritis. Now remember, these conditions, rheumatoid arthritis, sarcoidosis, lupus, scleroderma, do not have a uniform abnormality pathology under the biopsy microscope, and they are a little different. But in spite of that, the drug has been approved and the dosage is same, the side effects are similar. So essentially, in past, the physicians had dilemma. If somebody had rheumatoid arthritis and they had a progressive fibrosis, the insurance company could not approve OFEV, and insurance company would deny it because OFEV was not approved for scar tissue developed in patients with these kind of diseases. And that became a problem because if I wanted to use it, I could not use it. The drugs are expensive, and so there was a very tight control of it. But since then, within last 3 to 4 months or 6 months maybe, the studies were shown that even in conditions like rheumatoid arthritis, scleroderma, lupus, sarcoidosis, once the scars were progressive, we could use these drugs and stop the progression rate. So let me explain it this. So the drug is called OFEV, and this is not an advertisement for the drug. The common side effects are nausea, vomiting, diarrhea. Majority of the time, this can be well controlled with adjustment in the dose or taking additional medicines for the symptom relief. Like any other drug, we monitor liver blood tests, but most of the time it is very safe. The drug does not reverse the scar tissue formation, but it reduces the rate of decline of the disease. So if someone is losing lung capacity, say at 120 cc's per year, with the use of this drug, the decline may occur at a much lower rate. So that was the only advantage. But the advantage is not only simply because if there is a rapid decline, and typically idiopathic pulmonary fibrosis is universally fatal in 3 years or something like that, in this condition you can prolong the symptoms of worsening of shortness of breath and also prolong the life. So I just wanted to tell you that there is something called idiopathic pulmonary fibrosis, where there is a scar tissue in the lung which progresses rapidly, causes shortness of breath, cough, lack of oxygen, and uniformly is fatal. However, in my estimate, such a fatal progressive disease occurs in maybe 20% or less. In most of the other people, the disease is slowly progressing and many times may not reach the critical value where people are disabled. Again, one has to closely monitor the breathing test and an oxygen intake, then only he can know whether the disease is progressive or not. And if indeed the disease is progressive, then now we have a drug, as I mentioned, and the same drug is also approved for scar tissue, which is seen in connective tissue disorders like rheumatoid arthritis, lupus, scleroderma, sarcoidosis, etc. So this is an additional armamentarium for your treatment of scar tissues in the lung. Again, this is not just the garden variety tiny scar that might have developed related to previous pneumonia. It is used only in those serious, rapidly progressing or progressing disease. But to know the progress of the disease, one has to monitor closely. This is not a medical lecture, but I thought since I had recently few people calling me asking questions, I thought I would touch it. Thank you for watching. If you like it, please subscribe. Thank you. Have a nice weekend.